Hello, I'm Michael Pierce, and this is The Human Condition. Today our topic is the basics of hemorrhoids and natural remedies. This is a question from our audience. We've had people asking about this issue and patients asking about this issue in my practice as well. So I practice chiropractic neurology. Why am I talking about hemorrhoids? Because it's so important and so common and part of wellness. If a person has hemorrhoids, they are out of balance. Now that's not an indictment of the person or an accusation of them. It's just to say that it's a clear sign that something is not right and it really should be fixed. The digestive system is not supposed to have hemorrhoids normally. You know, there are normal parts of digestion, a little bit of noise once in a while, a little bit of gas, a little bit of rumbling. Those things are normal, but hemorrhoids are not. So if a person has hemorrhoids, we have to ask them what kind of hemorrhoids and why. The two kinds of hemorrhoids are internal and external generally. So an external hemorrhoid is one that is on the outside of the anus and the rectum that you can touch and see. It's very, very painful and very red and swollen. And the internal hemorrhoid pooches out of the wall inside the body before the actual opening. And so that is also acutely painful, but it's inside the body and you often can't see it. And you can't apply ointments to it. You can't apply a hemorrhoid ring or a seat ring in the case of the internal hemorrhoid because it's up inside your body. And so it may hurt regardless of whether you sit on a donut. Hemorrhoids are produced by inflammation of blood vessels that come from pressure in the colon and large intestine, especially the end, which is the sigmoid colon and the rectum. So this is the area where people have stored feces so that they can have a bowel movement later and not have a bowel movement on demand like a bird. Birds, have limited control of their bowels, and whenever there's something that moves through the tube, once it gets through the intestinal tube to the end, it just comes out. Now we have the ability to hold that so that we don't have that happen at inopportune times. So we can poop when we want to, usually. The hemorrhoid comes about from the opposite problem, which is you can't really get rid of it. Now, what is the job of the large intestine? The job of the large intestine, it has many jobs, but the main job of the large intestine is to dehydrate the feces that have come through your body. You've eaten some food, it's gone down your throat, it's gone into your stomach, it's been processed, it's gone through your small intestine, and it's gone through your large intestine. Once it goes through your small intestine, it's very wet, and it's been doused with digestive juices, it's been doused with bile, it's been all kinds of secretions have hit it, so it's very, very wet, and it's been added to by a lot of your body fluids. So at some point we need to reclaim that water so that we don't become dehydrated. So that's what the job of the large intestine is. It's to take back that water that we put in all those secretions, because all those secretions are water-based. When we recall and reabsorb that water in the large intestine back into our bloodstream, we carry it back into our circulation and return it to our body, leaving behind a stool that is drier than it was when it was in the small intestine. And it's not so dry that it shouldn't be so dry that it's hard to void. It should be wet enough that it can come out. And so that balance is something that the body knows how to do. But usually if we have a problem with the large intestine over-retaining this feces, it could be because it's drying out the feces too much, or the transit time of the intestine is too slow because of lack of fiber, or, as some people are saying who are advocating that fiber is not so important, maybe there just isn't enough bulk of the stool. There are carnivore diets and people that have low-carb diets that avoid a lot of plant fiber now. The prevailing wisdom was that plant fiber would save you from hemorrhoids, and that isn't always true. Certainly bulk and fiber, both soluble and insoluble fiber, can contribute to the bulk of stool and be able to make it easier to pass, but some people have difficulty with gastric and intestinal motility, where the peristaltic wave, or the active wave of pinching and moving food through the tube that is your intestine, is impaired. And that's a neurological condition. So once in a while, that can happen from simply something like a concussion that affects your brainstem, that can affect the vagus nerve and its ability to tell the intestines what to do. It can affect the spinal cord's ability to tell the colon and the intestines and the lower part of your pelvis what to do. It can also be from an autoimmune disease. There are various rarer autoimmune diseases similar to celiac disease, which usually attacks the small intestine. But there are other autoimmune diseases that can attack your nerves and your large intestine that could slow the motility of the large intestine. it's hard to get just large intestine reduced motility without also getting, reduced motility of the stomach and of the small intestine too. But, once in a while, you'll see everything sooner or later in medicine if you live long enough. So this idea of hemorrhoid is a pressure where a blood vessel pooches out and invades tissue that it shouldn't invade. It invades tissue that has poor ground substance. It's essentially saying that the vessel itself is inflamed and pushes out, but also that the surrounding tissue isn't strong enough. So if surrounding tissue isn't strong enough, we need to know what is that ground substance, what is that tissue made of that the blood vessel resides in that it pooched out of? What is the material that it pushed through, that it punched through? And that material is, we called it ground substance, and it's your main tissue. It's what makes you as a soft tissue. And it's made of protein. It's manufactured with protein fibers, and it's manufactured with the help of vitamin C and bioflavonoids. So a person needs to have vitamin C and bioflavonoids. A person needs to have adequate protein. A person needs to have adequate circulation, which we've talked about before, has to do with niacinamide. It has to do with other substances. Reduced inflammation is related to having enough vitamin E and a good healthy diet that isn't full of inflammatory carbs and inflammatory, alcohol and tobacco and sugar. And of course, fried fatty meats and fried fatty foods that are fried or trans fats. Now, luckily we're getting away from trans fats, so we don't have to worry about that so much anymore. But the general idea is if you've got a hemorrhoid, sometimes it's what you eat. Sometimes it's your nerves in your intestine. Sometimes it's the water in your intestine. Sometimes it's the amount of fiber or not. Sometimes it's the minerals that you eat. And so that's where we have to look at, again, what makes tissue flexible? Copper is the main thing that makes tissue flexible, especially blood vessels. So it's important to make sure your copper levels are checked over time and your zinc levels are checked. And then probably the most important thing is the mineral magnesium. Magnesium is incredibly important to make sure the bowels are moving and that they can have good motility. You can take too much magnesium. It isn't horribly dangerous in humans to take too much magnesium, as it isn't for other minerals. But if you do take too much magnesium, you can get some weird muscle cramps and you can get some strange gastric motility and intestinal motility problems where you have diarrhea. So sometimes it's as simple as taking extra magnesium. People that eat a ketogenic diet or a carnivore diet or that go low carb often are deficient in magnesium. And part of that is because when they make the argument that in the past we ate animal foods, they neglect the fact that today we don't have organ meats. And organ meats have all the minerals that we need, usually if the animals are healthy. But skeletal meat doesn't necessarily have all those minerals to the same degree that organ meat does. So if a person begins to eat skeletal muscle, which is steak and hamburger and other things, and they avoid carbs and they avoid fiber, they might and will end up with deficiencies of minerals, especially magnesium. So they've got to take supplemental magnesium if they're going to try that diet, and it will be very helpful. Now, if they have organ meats, they may get enough minerals and not have to take supplemental magnesium, and they may not have to take any fiber. So it's possible for a carnivore who's on a carnivore diet to eat only animal products. That usually includes dairy, but some people don't eat dairy and they can't handle dairy at all, so they just eat flesh. And if they do that, they can be very healthy, but it involves quite a lot of discipline and understanding what you're doing, especially at the beginning, and then it can be very easy. It may be confusing. Fiber is sometimes a cure, and fiber sometimes will make people worse. But generally, the treatment of hemorrhoids, again, depends on what's the cause. In your case, is it dehydration? Is it neural autoimmune disease? Is it a concussion in your brain or spinal cord that affects the nerves that tell your gastric motility and your intestinal motility to move? Is it a deficiency of minerals from any source? Is it heavy metal toxicity, which I always talk about? Is it a problem of too much refined grains? A lot of times people eat too much refined grains, which are things like pasta and white rice and bread and muffins and pancakes and all those things. Sometimes even refined potatoes, potato starch, even though potato is not a grain. This type of refined carbohydrates can really gum up the intestine and cause constipation, and constipation is generally the cause of hemorrhoids. If a person has no constipation, but they've got hemorrhoids, that's when we start looking at the ground substance. We start looking at, are they taking enough protein? Are they eating enough vitamin C? Often these are vegetarians that don't have enough protein in their diet. They've learned to get maybe 35 grams of protein a day, and they read that that's enough in a textbook somewhere, and they're very active people. Maybe they're young parents of children and they're chasing around kids, or they've got a professional job and they work 40 hours a week plus. And they need more protein for their brain, and they need more protein for their organs, and they need more protein to make healthy ground substance so that the tissue doesn't get pooched through by a blood vessel in your rectum or anus. So that is another possibility that we see, as a protein deficiency or a vitamin C deficiency that leads to a person having these confusing hemorrhoids in the absence of constipation. Some people have alternating constipation and diarrhea, and in my other YouTube videos we've talked about alternating constipation and diarrhea being a part of what? That is a bile problem. That is very often in the literature well discussed and is discussed hugely across the scientific literature. Problem of bile insufficiency and bile imbalance, alternating constipation and diarrhea. It's not always, but most of the time. I will never say always, and I will always say never. Well, sometimes. The final statement about hemorrhoids is, after you've looked at all those different things, there are some acute remedies, and there are many topical things that people put on themselves. Topical vitamin E is very nice. Topical ointments are very nice. Arnica can be also useful, although arnica is used in physical trauma. It also works in some cases for application of hemorrhoids. Aloe vera gel can work for topical application of hemorrhoids. But I think probably the most famous is the oral application of Collinsonia root, which is called stone root. And stone root has been a major remedy as an anti-inflammatory for hemorrhoids for a long time. And really all of the anti-inflammatory herbs like turmeric and ginger and resveratrol and Boswellia serrata, these are all herbs that are used to reduce inflammation and that can help a person deal with a flare-up of a hemorrhoid. But sometimes you need to see your doctor, and sometimes you need a hemorrhoid surgery. That's the concept of hemorrhoids, and I hope this has helped you.